Bismillahirrahmanirrahim. Push yourself because no one else is going to do it for you. This is the quote of the day. Assalamu alaikum. Today the topic of my presentation is amoebiasis and giardiasis. Both are waterborne diseases and as well as communicable diseases. Learning outline of my presentation. First, we introduce about a case presentation, then the burden of amoebiasis and giardiasis, epidemiological determinants, mode of transmission, a level of prevention, recent advances, and at the end, there is an MCQ session. At the end of this presentation, participants will be able to describe about the infection of amoebiasis and giardiasis, level of prevention, and recent updates. First, we discuss the case. A 42-year-old woman developed a temperature of 38.9 degrees centigrade with sweats, shaking, chills, headache, and slight constipation 2 days after returning from a rural area. She had not taken malarial prophylaxis during her 10-week stay in that area. The patient was found to have a white blood cell count of 28,000 per mm with a left shift and toxic granulation but no eosinophilia. Serum electrolyte and transaminase level were unremarkable. A chest radiograph showed minimal blunting of the right costophrenic angle. On the night the patient was admitted to the hospital, her temperature became elevated and she reported increasing tenderness in the right upper quadrant. Ultrasound examination of the right upper quadrant and CT scanning of the abdomen revealed 3 large abscesses in the right lobe of the patient's liver. The 2 largest abscesses were each 5 centimeters in diameter. Serological tests were positive for Amoeba histolytica and negative for Echinococcus species. So the most likely the diagnosis is invasive amoebiasis, which is the extra intestinal manifestation of this organism, Amoeba histolytica. Now the burden of disease. This is common infection of human GI tract. There is a worldwide distribution of this infection. Major health problem in China, Southeast and West Asia and Latin America, especially Mexico. Invasive amoebiasis account for about 10,000 deaths in the world. Prevalence rate was very high, almost 2 to 60% or more in areas which is devoid of sanitation. In high prevalence area, amoebiasis occur in endemic form as a result of high level of transmission and constant reinfection. Now comes the host, which is responsible for the for this infection. This is a pathogenic strain of Amoeba histolytica, and this strain exists in its 2 forms: vegetative form, which is also known as trophozoite, and a cystic form. And the cystic form is mainly responsible for the spreading the infection. Trophozoite form is short-lived outside the body. The survival of trophozoite form outside the body is not possible, and it is not important in the transmission of infection. But the cystic form are infective for the several days when it remain outside the body, and cysts are not affected by the chlorination of water. All ages are susceptible of this disease. Both genders are equally involved, and there is no as such lifelong immunity after we acquiring this infection one time. Environment factor, poor sanitation is the main cause of disease. Use of night soil for the agriculture, rainy season, seepage in the water supply, which is used for in the household chores. And the chain of transmission, man is the only reservoir of this infection. Both cases and carriers are responsible for the spread of disease. And the carrier of this disease almost discharge 1.5 multiplied by 10 raised to 7 cysts in a day. And the fecal-oral route is responsible for the transmission of disease. Contaminated water or food, epidemic waterborne infection can occur vegetable eaten raw form from that field where irrigation of sewage water is done, and the vectors which are responsible flies, cockroaches, and rodents which are carrying the cyst of the Entamoeba histolytica and contaminate food and drinks. This is the life cycle of Entamoeba histolytica, in which mature cysts which are ingested and then it is gone in the intestine, and then at the several site it causes the infection or the disruption of the epithelial lining of the GI tract, and then this cyst again cyst and trophozoite passed in the feces. Trophozoite cannot exist in the outside the body, but a cyst form is remain outside the body and it is in fact, and the disease is transmitted by the cystic form and it remain outside the body for many days and responsible for the spread of infection. Most common type of amoebic infection is asymptomatic cyst passage, and in intestinal amoebiasis, abdominal cramps with mild diarrhea to colitis and dysentery. In the extra-intestinal amoebiasis, amoebic liver abscess, rarely lungs, skin, genitalia, and CNS are affected. Inflammatory and edematous reaction around trophozoites. Complication of this disease, the bowel perforation, GI bleeding, stricture formation, fistula formation, amoebic liver abscess, peritonitis, pericarditis, empyema, and the brain abscess. These all are extra-intestinal manifestation of this disease when the cyst cross the GI tract and remain in these body parts. And in the level of prevention, we can prevent this disease by a health promotion like health education, prevent contamination of water, food, and vegetables from human feces, safe disposal of human excreta, the protection of water supply against fecal contamination, food and handlers should be diagnosed and treated properly. And in the specific protection, there is no vaccine which is currently available. Only protective measures can be taken for the prevention of this disease. Early diagnosis, with the help of microscopy, we demonstrate the trophozoites in red blood cell and detection of a cyst in a fresh stool sample. Immunoelectrocyte is most sensitive serological test, and ELISA is most sensitive for invasive amoebiasis, and the immunoelectrophoresis is also done for the diagnosis of this disease. And in the treatment, the first choice of drug worldwide for the treatment of amoebiasis is metronidazole, which is followed by diloxanide furoate or tinidazole followed by diloxanide furoate. And the second choice of drug is dihydroamidine followed by diloxanide furoate. There is a case definition which is used for public health surveillance case definition in clinical description. Infection of the large intestine by Entamoeba histolytica may result in an illness of variable severity ranging from mild chronic diarrhea to a fulminant dysentery. And what is the laboratory criteria for diagnosis? For the intestinal amoebiasis, demonstration of cyst or trophozoite of Entamoeba histolytica in stool, or demonstration of a trophozoite in tissue biopsy or ulcer scraping by culture or histopathology. And what the laboratory criteria for extraintestinal amoebiasis, demonstration of Entamoeba histolytica trophozoite in extraintestinal tissue. And which cases are confirmed? Confirmed intestinal amoebiasis, a clinically compatible illness that is laboratory confirmed. There are 10 reasons that we are not neglect the amoebiasis. It almost included in top 15 diseases which affect globally, and people die of amoebic colitis each year. Many people die due to this disease, and the travelers are almost susceptible to the amoebiasis. Oral and sexual transmission increasingly recognized, and the cases of dissemination facilities outbreaks among military and general public, and the misdiagnosed can lead to fulminant amoebic colitis, and the strain of amoebiasis is very hypervirulent, and in diagnosis there may be error, some misdiagnosed in the laboratory, and the only one drug is available almost for the treatment of this disease, and there is no recently vaccine is available for the prevention of this disease. Now comes the second topic, which is giardiasis, and this is the case presentation. A patient of 9.5-year-old with chronic pain abdomen was admitted in the gastroenterology and nutrition service. The patient had history of diarrhea or pasty stool, neither fever nor vomiting. The feces from patient were processed seeking for pathogenic bacteria, and the results were negative. The microscopic examination looking for cyst and ova after the centrifugation and concentration method was negative for cyst and egg. The lactose hydrogen breath test was positive. The presumptive clinical diagnosis was giardiasis, and the patient was empirically treated with nitazoxanide. So the most likely diagnosis of this disease is a giardiasis. Giardiasis is a global disease. It infects nearly 2% of adults and 8% of children in developed countries. 33% people in developing countries is suffering from this disease. And the agent which is responsible for this disease is Giardia intestinalis, is a protozoan flagellate. It also exists in two forms, tropozoite and a cystic form. All ages are susceptible. It is equal in both gender, and there is no as such lifelong immunity if we acquire this infection one time. Poor sanitation is responsible for the spread of disease, rainy season, and a food handler. Man is the only reservoir of this disease, and both cases and carrier are equally involved in the transmission of this disease. Cystic form is the infective form of this disease. Contaminated food and water is responsible for the transfer of this infection from one person to another. Person-to-person transmission in children, homosexual, and mentally ill person. This is the life cycle of Giardia intestinalis, and the transmission is a fecal-oral route. Almost ingestion of cyst more than 10 in contaminated water, food, and direct transmission by hand is responsible for this infection. And the cystic form is ingested by a man, and then this is causing a problem in the intestine, and then the tropozoite and a cystic form is again excreted in a feces. Flagellate cysts are susceptible to drying, heating, or prolonged exposure to feces, viable in cold water and chlorine treated water for months. Flagellated drops remain in small intestine, free living or attached to mucosa, self-limiting diarrhea, or may be asymptomatic. Trough may be present in severe cases. Clinical sign and symptom of giardiasis or diarrhea, malaise, weakness, abdominal distension, flatulence, abdominal cramps, nausea, malabsorption, anorexia, weight loss, vomiting, low-grade fever, various neurological symptoms, urticaria. And the complication of this disease is malabsorption, weight loss of a child, and a failure to thrive. In a level of prevention, we can educate the people, wash hands frequently, avoid contaminated water and food, use boiled water, prevent leakage or sewage in water pipelines. There is also no specific vaccination available for this disease. Only preventive measures can be taken. And the microscopic examination of trophozoite or a cystic form is a diagnostic and examination of a fresh stool specimen. Drugs commonly used to treat giardiasis are tenidazole, metronidazole, mebendazole, nitroxoxanide, and albendazole. Recent update. This is the case definition which is used in a surveillance case definition and clinical description: an illness caused by a protozoan Giardia lamblia and characterized by gastrointestinal symptoms such as diarrhea, abdominal cramps, bloating, weight loss, or a malabsorption. Laboratory criteria for the diagnosis of giardiasis. Laboratory confirmed giardiasis shall be defined as the detection of giardia organism, antigen, or DNA in stool, intestinal fluid, tissue sample, biopsy specimen, or other biological sample. Case classification, which is a probable case, a case that meets the clinical description and that is epidemiologically linked to a confirmed case, and a case that meets the clinical description and the criteria for a laboratory confirmation as described above. Diarrhea continue to a major contributing factor to morbidity and mortality worldwide. It is the second leading cause of death in children under 5 years. 3 intra-aeroparasite Entamoeba histolytica, Giardia lamblia, and Cryptosporidium parvum are common infectious agents causing persistent diarrhea. The global burden of disease found that amoebiasis were responsible for more than 55,000 deaths and 2.2 million disability adjusted life years, and a cryptosporidiasis account for about 10,000 deaths and 8.5 million delays. And according to WHO, foodborne disease burden epidemiologically, reference group giardiasis produced 171,000 delays. Giardiasis did not result in death. The annual cost involving the hospital-based treatment for giardiasis is approximately 34 million. In addition, Entamoeba histolytica, Giardia lamblia, and Cryptosporidium parvum are considered to be a bioterrorism threats by National Institute of Health and CDC. In absence of vaccine to prevent these parasitic disease, control relies on a chemotherapy which is far from perfect and limited by adverse only one drug which is used worldwide, and this is a metronidazole. So there is a requirement for a better drug development for the treatment of this disease, these 3 diseases. National Outbreak Reporting System, waterborne diseases and outbreak reporting to a waterborne disease and outbreak surveillance system, transition from a paper-based system to electronic National Outbreak Reporting System. Nearly 10,000 people in the United States get sick from a foodborne, waterborne, and enteric illness outbreak each year, according to information reported in National Outbreak Reporting System. Now it's time for the MCQs. Entamoeba histolytica is responsible for the spread of protozoal diarrheal disease. This infection is most often acquired by consuming food contaminated by trophozoite, consuming food contaminated by cyst, drinking water contaminated by trophozoite, not thoroughly washing after using the washroom, consuming food not properly cooked.
A.
B. Consuming food contaminated by cyst. Cyst is responsible in the spread of infection, not a trophozoite form. Malabsorption and atrophy of the villi is caused by the following intracellular intestinal parasite: Giardia lamblia, Entamoeba histolytica, Strongyloides stercoralis, Cyclospora catenans, and Cryptosporidium parvum.
B.
A. Giardia lamblia. According to surveillance case definition, the laboratory criteria for the diagnosis of Entamoeba histolytica is the presence of cyst in blood, saliva, stool, urine, or plasma.
C.
C, stool is the right option. A 30-year-old man having history of travel 10 days back, and now he presented in emergency with high-grade fever, rigors, and chills. Also complain of constipation. CBC show increased WBC, and chest X-ray revealed slight bulging of costophrenic angle. What is the likely diagnosis? Amoebiasis, invasive amoebiasis, giardiasis, malaria, typhoid.
B.
B. Invasive amoebiasis is the right answer because chest X-ray revealed slight bulging of costophrenic angle. 8-year-old child presented in OPD setting with complaint of abdominal pain and pasty stool, and the child is failure to thrive. CBC show microcytic anemia. Stool examination shows the presence of cyst. What is the likely diagnosis? Giardiasis, amoebiasis, hemolytic anemia, pernicious anemia, invasive amoebiasis.
A.
A. Giardiasis is the right answer. Amoebiasis is transmitted by the transfer of cysts in different products of food in an endemic area. Which of the following cyst passer need to be treated? Incubatory carrier, food handlers, cases, healthy carriers, or are asymptomatic carrier?
B.
B. Food handlers must be treated in the endemic area. There is no licensed vaccine against both diseases, amoebiasis or giardiasis. Drug is the main line of treatment. Which is best choice of drug in both diseases? Metronidazole, furazolidone, paramomycin, and quinacrine and nitrazolidine. A. Metronidazole.
B.
Each of the following statement concerning Giardia lamblia is correct, except Giardia lamblia has both stages, trophozoite and cyst. Giardia lamblia is transmitted by fecal-oral route. Giardia lamblia cause hemolytic anemia. Giardia lamblia is responsible for giardiasis. Giardia lamblia is diagnosed by the presence of cyst in stool.
C.
C is the right option. In the life cycle of both Entamoeba histolytica and Giardia lamblia, different forms are present. Which form is more infective and the important in the mode of transmitting disease? Tropozoites, merozoite, cystic form, egg form, or promerozoite?
A.
Cystic form is responsible for transmitting the disease. Entamoeba histolytica is responsible for causing amoebiasis, and the most common site for amoebiasis is cecum, sigmoid colon, transverse colon, descending colon, or hepatic flexure.
A.
E. Hepatic flexure is right answer. This is the key of my MCQs, and thank you.
Thank you very much, Dr. Naila. Very nice presentation. And there are many different aspects of amoeba histolytica that has been covered brilliantly today. And I hope everybody has a very clear concept how it is being transmitted, how it can be prevented, what are the treatment options, and what are the sites where Entamoeba histolytica is commonly found. Another important thing is that you have highlighted is about the life cycle and what is the most infectious thing in the life cycle. And no doubt it is the cystic phase. Thank you very much. If anybody has any question, please do let us know. Thank you. Allah Hafiz.
The office, ma'am.